Okay, let's look at this staggering number right off the bat. In 2021, 14.6% of women aged 18 and older in the United States had undergone a hysterectomy. And if you look at women aged 75 and older, that number jumps to over 41%. We are talking about one of the absolute most common surgical procedures performed today. But despite how routine that sounds, there's actually a hidden variable that drastically alters how safe and successful this surgery really is. Welcome to today's Explainer. Today, we're launching a bit of a medical investigation into a really fascinating retrospective cohort study out of Cedars-Sinai Medical Center. This study, which was published in the Journal of Minimally Invasive Gynecology, uncovers something pretty incredible about who exactly is holding the scalpel during these procedures. We're going to look closely at the data to reveal how specific surgical training changes everything about a patient's recovery and safety. Here's our case file for today's Explainer. First, a very common surgery. Then, meet the surgeons. Next up, comparing the surgical outcomes, followed by, does practice make perfect? The subspecialty advantage, and wrapping up with, what this means for you. Let's get right into it.
Section 1. A very common surgery.
Section 2. Meet the surgeons.
Now, even though these minimally invasive surgeries are a massive medical advancement, major complications do still happen in up to 19% of cases. So you've got to ask, who is actually holding the scalpel? The study clearly divides the operating surgeons into three distinct camps. First, we have fellowship-trained minimally invasive gynecologic surgery subspecialists, or MIGS for short. These are surgeons who've completed extra years of training focused entirely on complex, benign conditions. Second, we have gynecologic oncologists, or GOs. These are highly skilled subspecialists too, but their daily focus is primarily on cancer. And third, we have general obstetrician gynecologists, the OBGYNs we all know, who handle everything from delivering babies to routine checkups and surgeries. So that's three very different backgrounds performing the exact same type of benign surgery.
Section 3. Comparing the surgical outcomes.
So, what happens when we stack the surgical outcomes of these three groups against each other? Honestly, the disparity here is just jaw-dropping. If we use the MIGS surgeons as our baseline, so a baseline of 1, the numbers show that patients operated on by general OBGYNs were 6.84 times more likely to experience a major intro or post-operative complication. And for the gynecologic oncologists, the odds were actually 7.02 times higher compared to the MIGS group. I mean, let that sink in for a second. Roughly 7 times the odds of a major complication purely based on the surgeon's specific training background.
If we distill all this dense data down into one unforgettable takeaway, it's this. More targeted training equals significantly fewer complications. It's like a shield. The protective power of that highly specific MIGS subspecialty training is just undeniable when you look at the numbers.
Let's check out another massive clue in the data. You know, one of the biggest fears going into a minimally invasive surgery is what doctors call conversion to laparotomy, which basically means things get a bit too complicated and the surgeon unexpectedly has to abandon the small incisions and open the patient up. Well, check this out. The MIGS surgeons almost never had to do this. Their conversion rate was a tiny 0.3%. Meanwhile, the GOs and general OBGYNs had to pivot to open surgery 7.6 and 7.9% of the time, respectively. That is a huge difference.
Which brings us to Section 4. Does practice make perfect? So you're probably wondering, does this massive difference in safety just come down to practice? Like, who does it the most? Well, to really unpack this, we need to look at two crucial factors for surgical success. Number one is high surgical volume, literally just the frequency of operating. Simply put, doing a lot of surgeries generally makes you better at them, right? But the second factor is condition-specific knowledge. That means having targeted training for the specific, complex, benign issues you're actually trying to fix, things like severe endometriosis or really large fibroids.
And guys, here is the brilliant plot twist of this whole investigation. Notice the annual volume of these minimally invasive hysterectomies. General OBGYNs had a pretty low volume, only about 3.6 of these surgeries per year. So yeah, their higher complication rate kind of makes sense under the volume theory. But look at the gynecologic oncologists. They had a really high volume of 31.7 per year. That is nearly identical to the MIGS surgeons who did 37. Yet, as we just saw, the GOs still had those really high complication rates for these benign conditions.
This drives home a massive realization in the medical community. High surgical volume? It's just not enough on its own. The gynecologic oncologists are incredibly skilled, super high volume surgeons, for sure. But their training is laser-focused on cancer, not on the tricky nuances of complex benign diseases. You really need both, the volume and the precise condition-specific training.
All right, Section 5, the subspecialty advantage.
So what actually makes this hidden variable so uniquely effective? Well, MIGS fellowship training is this specialized medical pathway focused exclusively on safely treating complex benign gynecologic conditions. We're talking about tackling massively enlarged uteri due to fibroids, adenomyosis, severe endometriosis, heavy scar tissue from previous surgeries, the whole shebang. These surgeons literally spend their entire fellowship learning reproducible, minimally invasive techniques to take on the absolute hardest benign cases without having to resort to open surgery.
And the operative characteristics reveal something super fascinating here. Check out the specimen weight row. The MIGS surgeons were actually dealing with significantly heavier, way more difficult uteri, averaging 469 grams. Compare that to the GOs at 182 grams and the OBGYNs at 318 grams. But here's the crazy part. Despite tackling the largest, toughest cases by far, the MIGS surgeons still managed to pull off shorter surgery times, less blood loss, and vastly lower complication rates.
It's the ultimate paradox proven by this study. Harder cases, better outcomes. The doctors who are voluntarily stepping up to the most difficult benign anatomies are actually producing the safest, fastest recoveries for their patients, and it's purely because their specialized training is a perfect match for the problem at hand.
Finally, Section 6. What this means for you.
So, we've geeked out over the clinical data and the odds ratios, but how do you actually use this information? I want to anchor our conclusion in the exact final words of the researchers themselves. They wrote, "Fellowship-trained MIGS subspecialists had improved surgical outcomes for benign, minimally invasive hysterectomy, with lower rates of perioperative complications and fewer conversions to laparotomy." Look, the evidence is crystal clear here. The type of doctor you choose is an incredible statistical predictor of your safety, your recovery time, and your overall success.
So what are your actionable takeaways today? First, always check your surgeon's subspecialty. Are they a generalist, an oncologist, or a MIGS specialist? Second, do not be afraid to ask about their annual surgical volume, specifically for benign, minimally invasive surgeries. And third, if you've got a complex benign condition, maybe large fibroids, severe endometriosis, or previous abdominal surgeries, strongly consider seeking out a fellowship-trained MIGS subspecialist. It could literally be the difference between a breezy recovery and a major complication. At the end of the day, it's your body, your health, and your recovery. This data empowers you to advocate for the absolute best care possible. So the next time you or someone you love is recommended for a procedure, I want you to ask yourself this one vital question. Who is performing your next surgery? Thanks so much for joining me on this explainer. Keep asking those right questions, and I'll see you next time.